Welcome to the training. This course contains audio, so please adjust your speakers as needed or use headphones. You can also view the narration transcript at any time by clicking the Notes tab in the left navigation pane. When you're ready, begin making your way through the course by clicking the Next button below. You are now beginning Lesson 1 of the Substance Use Disorder Prevention and Mental Health Promotion Online Reporting System Training Series. This system is supported by the Washington State Healthcare Authority, Division of Behavioral Health and Recovery, as its primary prevention management information system. It was launched in the fall of 2016. Although officially named the Substance Use Disorder Prevention and Mental Health Promotion Online Reporting System, we refer to this system as Minerva, a reference to the Roman goddess of wisdom. This lesson provides an overview of Minerva. Click each arrow to see the training objectives. Once finished, click the Next button to continue. The Substance Use Disorder Prevention and Mental Health Promotion section is located in the Healthcare Authority's Division of Behavioral Health and Recovery. Our mission is to create a culture throughout Washington State that promotes prevention, wellness, and behavioral health. Data is critical to that mission. We use data to understand the extent of the problem, to target our plans to the root causes of the problems, and to support our messages to partners and stakeholders. We accomplish this mission with input from local, state, and national partners by using our state strategic plan. You can click the link to review the State of Washington Substance Abuse Prevention and Mental Health Promotion 5-Year Strategic Plan, and by focusing on prevention strategies, including underage drinking, marijuana misuse and abuse, prescription drug misuse and abuse, tobacco use, adult alcohol misuse and abuse, depression, and suicide ideation. Click each arrow to see how Minerva fits in with the HCA DBHR mission. Click the Next button when finished. Now let's learn about the resources available to help you as you work with Minerva. The Athena Forum is for prevention professionals in Washington State to find relevant guidance on substance use disorder and mental health promotion. It is open to everyone and can be found at theathenaforum.org. The Minerva login page links to the reporting system itself, to the Minerva knowledge base, and to the calendar, which provides information on Minerva-specific technical assistance calls. Find it at theathenaforum.org/Minerva. The Minerva Knowledge Base provides links to the user guide, as well as reference guides specific to organization types and specific programs. This is located at theathenaforum.org/MKB. Click each link. You may want to bookmark these on your browser for future reference. Links can also be found in the Resources tab on the upper right-hand side of your screen. Once you've clicked all 3 links, click the Next button to continue. You will find the link for Minerva at the main Minerva page on the Athena forum. This is what the login screen looks like. To log in, enter your username and password and click Login. Remember, this is different from your login for the Athena forum. You'll have the opportunity to request a new Minerva account once you complete Lesson 1 and Lesson 2 of this training series. A neat feature of Minerva is that you can submit a help ticket without logging in. Use the link on the login page. Our help desk is very responsive and usually able to assist with many issues. If they think DBHR's input is needed, they will forward the ticket to us. Use the "I forgot my password" link to request a reset of your password. You'll need the email address used when you signed up for Minerva. Once logged in, the Minerva home screen includes a number of different menus and features. In the upper right-hand side, you'll always have access to 3 key tools: your profile, help desk ticket, and to log out. Click the person icon to see the menu options, then click each box from the menu. Click the next button to continue. We will now take a brief tour of the layout of Minerva. On the home screen, you'll also find our welcome message plus important announcements that we periodically place on the home page. Modules in Minerva correspond to a different part of the prevention process and have associated items to report. Together, these building blocks make up the Minerva system. The menu of modules to the left is always visible. You will learn more about each module in Lesson 2. Click on each module to learn more. When you're done, click the next button to continue. Some modules contain logs or submenus that provide additional tools for reporting. Click the Implementation module to see an example. Then click the next button to continue. Please note, Minerva will automatically log you out after 15 minutes of inactivity. With 5 minutes to go, a message will pop up asking if you need more time. This is a good reminder to save your work. Section 1 of the Minerva User Guide provides more information on getting help with Minerva and provides more details on modules and logs. Click the image to download the Minerva User Guide. Click the next button to continue. Minerva is a tool used to track planning, implementation, and evaluation of prevention activities. It is a reflection of the work that you are doing in your community. Each part of Minerva and associated action steps corresponds to actions that you have done or will do in your community. You may be familiar with planning frameworks, such as the Strategic Prevention Framework. Modules in Minerva are set up to support this process in your community. The following will compare planning framework steps to actions taken in Minerva. You will learn more about each step in future lessons. First is getting started. In a community-based process, examples of this would be selecting and defining a community on which to focus prevention services and hiring prevention staff. This translates to Minerva actions of account management, organization profiles, and your user profile. In the next set of lessons of this training series, we will provide more information on getting started in Minerva. The next step is assessment. On a local level, assessment can include collecting a needs assessment by using local and state data and getting input from the community, determining what resources already exist in the community and how you can fill those gaps, and considering sustainability and cultural competency when collecting and reviewing data. Using the information gathered from assessment, planning then takes place to develop an action plan. In Minerva, this translates to creating program planning profiles. In the next set of lessons of this training series, we will provide more information on planning with Minerva. Implementation follows planning. Here you provide local prevention services as described in approved strategic plans, action plans, and budgets. In Minerva, implementation involves creating activity logs to group together series of sessions and entering session data itself. In the next set of lessons of this training series, we provide more information on implementation with Minerva. Finally, once strategies are implemented, you evaluate the process and outcomes to help understand successes and challenges and plan for the future. In Minerva, you can request a number of reports to assist with evaluation. In the next set of lessons of this training series, we provide more information on evaluation and reports. Click each box to complete the sentence. Then click the next button to continue. Now let's review why we collect data entry on prevention strategies and services. Remember that we all use data to tell our prevention story, maintain existing funding and apply for new funding, meet state and federal reporting requirements, and provide or review backup documentation for billing. So far we've covered the why of Minerva and toured the system. We will finish this lesson discussing data security and data integrity. In this context, data security refers to the policies, practices, and system features that help ensure participant information is protected. As prevention providers, we have a responsibility to guard this information and assure there are no data breaches. We risk damaging client and community relationships and ultimately hurting our community if we cannot maintain this trust. Data integrity refers to ensuring that the information entered into Minerva is accurate. This in turn helps ensure the reliability of our reports. Data integrity is the thing that keeps us from steering the ship in the wrong direction. If we don't have valid information, we risk putting resources into programs and strategies that don't lead to desired outcomes. Why is data security important? Click each arrow to see, then click the next button to continue. There are a lot of ways to define data. As prevention providers, we mostly define data in three ways: public data that can be shared with anyone, sensitive data that should be only shared within the organization that collects it, and confidential data that can only be shared with those who have a legal right to know and should be done so in a secure manner. There are many laws that cover data collection. Here we will review the 3 most common to consider when doing prevention work. Click each box to learn more, then click the next button to continue. Data security begins with having policies and putting them into practice. The responsibility of data security is with Minerva users and DBHR. Click each arrow to see what policies are in place at DBHR to ensure data security. Then click the next button to continue. There are many ways you can help protect the data you collect every day. First, do not leave forms or other papers that have personal information sitting out on your desk where others may easily see them. Make sure to keep pre- and post-surveys, sign-in sheets, and other documents in a locked cabinet. Password lock your computer or laptop every time you step away. Do not discuss individual data in public areas. Do not save your Minerva password where it might be easily found. Use strong passwords and change them periodically. Have all the individuals who work with private health information read and sign a data privacy agreement. Do not take protected health information home with you. Leave it at the office. Do not email protected health information to anyone unless absolutely necessary and authorized by agreement. If information is sent through email, it must be encrypted. Does this scenario sound familiar? There are often concerns from organizations and participants about collecting personal information. There is no audio for the next 3 slides. Please read the following scenarios at your own pace and use the next button to advance the training. Minerva is a secure system with a number of security features, but as with any system, online or not, ensuring security depends on all system users following policies and best practices. Section 2 of the Minerva User Guide covers a detailed description of Minerva data security features. Open the copy of the user guide you already downloaded and go to Section 2. Or you can download another version by clicking the user guide image. Click the next button to continue. As a reminder, data integrity is the quality and accuracy of data entered into Minerva. If you're not sure how to enter something, there are several options to get help, including reviewing the online trainings, attending a Minerva technical assistance call, reviewing the Minerva user guide, checking out the Minerva knowledge base on the Athena forum, or asking a DBHR staff member for help. We think this is an appropriate time to say thank you. So, thank you! We appreciate the work you do and value your commitment to providing prevention services while incorporating these principles of data security and integrity into your work. You have now reached the final knowledge check of this lesson. Please complete the quiz, then click the next button to continue. There is no audio during the knowledge check. You have completed Lesson 1. Return to OWL eLearning to start Lesson 2, where we will cover in more detail how to enter data into Minerva. At the end of Lesson 2, complete the survey to request your Minerva user account.